So we're going to go ahead and finish up the unit today. We're going to finish off by discussing vital signs. Vital signs are especially important in assessing your patient. When we're talking about your vital signs, we're talking about temperature, pulse, or heart rate for pulse, respiration, and blood pressure. These are also known as the cardinal signs, and any changes in this vital signs could be a difference of life and death. It says down here that the brain cannot function for more than 4 to 5 minutes without adequate supply of oxygen. Emergencies will arise requiring the radiographer to make certain that there's functioning instruments to assess these different vital signs. The first one we're going to be talking about here is temperature. Basically what temperature is your core heat involving metabolism. So it is a measurement of the state of metabolism of your body. It is a physiologic balance between outside environments and your inside environment. Even with changes of 2 to 3 degrees can be, again, very substantial and very critical. Your body temperature is controlled by your hypothalamus, and as we discussed in the last couple of lectures, that even with prolonged fever, we're talking about high temperatures, it can cause drastic changes in your central nervous system. The result may be a cause of seizures, convulsions, as well as coma. Okay. Some symptoms of a fever includes fast heart rate, increased pulse. Remember, we're talking about here increased temperatures. So when your body's heat arises, it is going to be utilizing all your bodily fluids as well as your oxygen. Okay? It is what feeds the temperature. So as your temperature goes up, this should make sense to you, right? Your heart rate's going to go up. Your respiration is going to go up. Again, it's utilizing all those different elements. Oxygen, fluids. So it makes sense that your heart rate's going to go up. Your respiration is going to go up. Okay? You're going to have a general discomfort or aching. Your body might feel hot and also flush. And because your body's hot, any changes in your environment temperature will cause chills. You may have a loss of appetite. Bright eyes is what they call it, where your eyes look very glassy. Restlessness and also thirst. Now, okay, again, this makes sense, right? Because it's utilizing your bodily fluids. So depending on what facility you're going to end up in, okay, they may choose to use Fahrenheit for temperature or Celsius. Okay, I've worked in many facilities. One place they're using Fahrenheit, and another place they're using Celsius. One place they're using pounds, another is using kilograms. Okay, you got to know how to convert these units. So I put up here how to make those conversions. Okay, you think there's a reason why I put this up here? Yeah. All right. Okay, so be familiar with how to convert it. So be able to make these calculations in your head. I'm just kidding. I use a calculator. I can do this. Okay. Any questions here? All right. 4 places. We're going to talk about 4 places in which temperature can be taken. Now, the general way that we take these temperatures is by use of thermometer. Are some of you guys familiar with the glass thermometer? Okay, some of them are still in existence. Okay, we use them for certain types of circumstances, but for the most part, they are there, but we don't use them as much as the electronic devices now, and there are some slides on here that shows that. But when taken orally, the probe is placed underneath the tongue. Okay, but make sure that the patient hasn't eaten or drank anything that is hot or cold, because it can skew up the numbers. Okay, so if they did take anything that is hot or cold, you want to wait approximately 15 minutes. You don't want to use a thermometer by mouth if the patient is using a mask to breathe, okay, because that's going to interfere. Patients who are unconscious, delirious, or unresponsive. Okay, what we're trying to do here is we're trying to prevent any type of injury, because if they clamp down on that probe, they can cause damage to their oral cavity. Okay, now think of this if it was a glass thermometer. That's going to cause a lot of problems, don't you think? Okay, infants, we don't use it. Okay, generally with infants, we take a rectal reading. You don't do it in surgery. If there's any injury to the nose or mouth, again, history of convulsions. We're trying to prevent any type of injury to the patient by use of taking the vital signs orally. Also, if they're unable to breathe. Now, here's an interesting factoid. Did you know that chewing gum and smoking increases metabolism? It increases body heat. Did you guys know that? Yes, no? No. It does. Okay? So what is the first thing, what is the first thing that happens when somebody stops smoking? They gain weight because it affected their metabolism. Once they stopped smoking, okay, their metabolism slowed down. Their body temperature went down. Chewing gum does the same thing. Okay? So if you guys want to lose weight, don't smoke. Chewing gum is a great thing. So it does lower your temperature. Okay? I'm sorry, it increases your temperature. When you stop, it lowers it. Okay. So a variance of 0.5 to 1 degree above or below average is normal. So we can have variances. The normal reading orally is 98.6 degrees. 98.6 degrees or 37 degrees Fahrenheit. Now, when noting temperature, not only do you note temperature, but you also got to note where it was taken. Okay? So written 98.6 degrees, O for oral, or 37 degrees Celsius, O for oral. Okay? There's also going to be some variances on the age. Okay, 5 years to 13 years, their temperature is just going to be slightly lower, whereas with infants, their temperature is going to go up maybe one degree. Okay, so there are variances based on age. Okay. Okay, this is talking about glass thermometer. Again, they're not so common nowadays, but we do use them sometimes for rectal type of temperature readings, especially with the infants. One thing that I want you to get out of this is that if you're using a thermometer orally, okay, it is used for oral. If you got one for rectal, it is used for rectal. Do not swap them. Do not interchange them. Okay? That's just nasty. Okay. All right, so electronic thermometers. The good thing about these is that it can be used over and over and over again. Okay? Whereas, with the glass thermometer, you got to constantly sterilize it, disinfect it. Okay? With these, there is a metal probe that is covered by a plastic cover, a plastic sheath, and after each use, they just remove the plastic cover. It can be used again on the next patient. So that's a great thing about these. Okay, next one here is axillary temperature. Not as accurate as oral, okay, but it's a good place if you can't put the thermometer orally or rectally. Okay, is axillary, under the armpit. You have to make sure that there isn't any excessive sweat, there isn't any deodorant, there isn't any type of moisture in the armpit, because again, that can skew the reading. Okay. You leave under the arm for approximately 5 minutes. Normal reading. Okay, remember orally is 98.6, axillary is 97.6. Okay. Not at all accurate, but at least we can get some kind of reading if we can't do it orally or rectally. The way you write this down is 97.6A, which stands for what? Axillary or armpit. Okay, axillary armpit. All right, next one here is rectal. Blunt tip glass thermometer use is the most reliable because it's close, very close to your core temperature. Okay? Usually done on infants. Should be done if patient is, should not be done if patient is restless, because they can break the tip or cause internal damage. Has a rectal pathology such as tumor or hemorrhoids. Okay? And obviously, yeah, you want to wear gloves when you're doing this. And be nice to your patient, lubricate it. Okay? Never leave the patient alone. You must hold in place for about 2 to 3 minutes. Okay? Oral 98.6, axillary 97.6. This is as close to the core temperature as you can get, 99 or 99.6, around there. Okay? And it's written as 99.6 R for rectum. Okay? Any questions? All right, let's keep on going. Last one here is tympanic or oral thermometer. This reads the temperature off the blood vessels out of your ear. Okay? It can be accurate if used properly. If it isn't used properly, the numbers can be, again, skewed. So this is pretty, you can also get a pretty accurate reading out of this. Okay? So it is written as 97.6, for example, T for tympanic, T for tympanic. And then they also have different types of thermometers, usually in forms of dots or strips, that can be placed on the forehead, on the chest, on the abdomen. Okay? They're usually done in surgery, in OR. All right, any questions here? Okie dokie, let's keep on going. So let's talk about some temperature terminology. First one here is pyrexia. Pyrexia is an elevated body temperature. As we said before, frequent complication of fever is convulsions, seizures, may cause coma, may cause central nervous system damage. Next one here is undulating and intermittent. Undulating and intermittent. This is alternating between a fever, high temperature, and normal temperature. So it goes up and it goes back to normal, up and back to normal. Okay? But the key here is that it goes back to normal. As opposed to remittent. You may have an elevated temperature, it drops but never goes back to normal. It goes up and down. It fluctuates but never goes down to normal, unlike intermittent or undulating. Okay? Next one here is crisis. Crisis is a sudden drop in temperature. A sudden drop in temperature. This is the turning point of some kind of sickness. It's a sudden drop in temperature. Whereas lysis, okay, crisis is sudden, lysis is gradual. It's a gradual drop. Okay? Efebrile is without a fever. Hypothermia is lower body temperature. Can cause death if below 93.2. 93.2. This is just a difference of 5 to 6 degrees. Doesn't sound like a big deal, but it is a big deal. And then also the other end, if you have an increase of about 5 or 6 degrees here, you have hyperexia, elevated body temperature. Okay? Any questions? All right. Factors that affect temperature. Temperature is usually low in the morning and high at night. Where you live, your environment can also cause changes in your body temperature. The time of day, as we said. Age, right? We talked about age earlier. Higher with infants. It goes high with infants, then it goes adults, then adolescents. Okay, from high to low. Infants, adults, adolescents. Okay, physical exercise can change temperature as well as injury. We're talking about sickness. Okay. All right, any questions? Second cardinal signs is pulse. We're talking about here heart rate. You can feel the heart rate at different areas of your body by palpating arteries that are superficial by pressing them up against the bone. There's a total of 9 areas in which you can detect pulse. This first 7 is going to be the most popular. Okay, we'll talk about this in just a second. But your normal heart rate should be 60 to 90 beats per minute. It should be rhythmic. There is a rhythm to it. Boom, 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 boom. 60 to 90 beats per minute. The term for rhythm, when we're applying it to the cardiac, is sinus rhythm. Sinus rhythm means that there is an even beat to it, an even rhythm. Sinus. Have you heard of sinus brady? Sinus bradycardia, what does that mean? It's a slow heart rate, but there is a constant rhythm to it. And I'm sure you've also heard of sinus tachy or sinus tachycardia. It's a fast heart rate, over 100 beats per minute, but it is rhythmic. If there isn't a rhythm to it, it's either called arrhythmia. What does A mean? Without. Or dysrhythmia. Okay, that means irregular. Okay, so you can have an arrhythmia or a dysrhythmia without a rhythm or irregular rhythm. Okay. Normal heart rate 60 to 90. Older, it starts to slow down a little bit. We have said that it is going to be a little bit faster with infants. Right? Temperature's up. Infants also has a fast heart rate because they're growing. They're using up all their energy. Okay. Monitoring. I'm losing my voice. Monitoring measured strength and regularity and number of beats per minute. So we're going to monitor the beats. We're going to monitor the strength and the regularity. The normal rhythm of the pulse beat is regular with equal time intervals between each beat. The 9 sites where pulse can be detected. Number 1 is the apical. When we're talking about apical here, we're talking about the location of your left ventricle. Right? Left ventricle is where it pumps out the heart. Pumps out the blood out of your heart. Okay? Where is your apex of the heart located? When you do the Pledge of Allegiance, some of us do. Okay? When you do the Pledge of Allegiance, it says put your right hand over your heart. Well, my heart's in the middle, isn't it? Where's the apex?
At the bottom, right?
Down here. Okay, so we're usually putting our right hand over the left part of our chest. So that's where the apex of the heart is located. Number 2 is the radial. Okay, radial is at the base of your thumb, where your wrist is. Okay, so you feel up against the base of your thumb, up against the bone. Oh, there it is. Okay, so that's your radius. Carotid. Okay, your jaw is an L shape. It's an L shape. So right where it changes angles, this is known as the angle of your mandible. Right below that, you're going to feel your carotid pulse. Okay? Femoral. The femoral artery is in the groin area. I'm not going to show you where that is. Okay? But it's here. Now, it is a very large artery. The femoral artery, which is a great thing, but here's the downside to that femoral artery. It's also superficial, close to the top of your skin. So when somebody has any type of car injury, let's just say, for example, the femoral artery gets easily severed. Okay? It can rupture because it's so superficial. Okay? So generally when there's those type of serious injuries, it's usually either in the aorta or in the femoral artery that causes rupture. Popliteal. Where's popliteal?
Behind the kneecap.
Behind your knee. Okay, good. Temporal. Well, everybody knows where their temple is, right? You guys get a headache and you're like, your fingers go up here. You get a throbbing headache. Well, you're getting a throbbing headache because you have an increased heart rate and your blood pressure goes up, so you're going to feel it right here in your temples. Okay? Dorsal pedis, or the pedal pulse. It's located at the top of your foot, top surface of your foot, between your first and second toe. Okay, on the surface of your foot between your first and second toe. Okay, these are the 7 common. Okay, now the not so common areas, first one is posterior tibial. This is on the inner surface of the ankles, and then 9 is brachial, between your biceps and your triceps. Okay? Usually the pulse is rapid if the blood pressure is low, and slow if the blood pressure is high. Remember we talked about that before? The whole purpose is that we're trying to maintain constant volume. So one goes up, the other one has to adjust to maintain the same volume. So blood pressure goes up, okay, heart rate's going to go down. Blood pressure goes down, heart rate's going to go up to maintain a constant volume. Now, when you're feeling for the pulse, you can use all your fingers but your thumb. Why can't you use your thumb?
It has pulse.
His own pulse
Okay,
too.
the
Yeah.
thumb itself has a pulse. Okay, the thumb itself has a pulse. So you don't want to confuse yourself. All right, so here's a better picture which locates the 7 common: carotid, temporal, apical, radial, ulnar, femoral, dorsal pedis. Okay, ulnar is also there, but that's not a common place. Brachial and posterior tibial are the 2 uncommon places to find the pulse. Okay, any questions? So again, this is a large artery right here, the femoral artery, very superficial, right at the top, right underneath your skin. Okay, some pulse terminology. Tachycardia. Normal beat is between what? 60 to
90.
60 to 90, all right? So tachycardia is anything over 100 beats per minute. This can be caused by excitement, exertion, anger, fear, heart disease, heart failure, hemorrhage, drugs, and an overactive thyroid. Okay? These are some of the things that will increase your heart rate over 100 beats per minute, tachycardia. Now, here's another interesting factoid. When your temperature goes up, and when it becomes elevated, your heart beats per minute increases by 10 for each degree it goes up. Okay, so it goes up 1 degree, you get 10 extra beats per minute. Okay, 2 degrees, you have 20 extra beats per minute. So naturally, when your temperature goes up, again, it's utilizing all the oxygen in your body. Heart rate should go up, right? Does that make sense, guys? Okay, bradycardia. Bradycardia is the opposite. Anything below 60 is considered bradycardia. May be caused by cerebral hemorrhage, heart attacks, heart block, and also a long feverish illness. Now here's something interesting, below 60. Can you be normal having heart rates below 60?
Mm-hmm.
Of course you can, right? I had this patient one time, and I was prepping him up, and I was taking his vitals, and I was feeling his pulse, and I was also looking at his EKG reading, and I'm doing this. And I'm looking at him. I'm like, are you okay? And I'm looking at him, and I keep thinking that he's going to pass out on me or he's going to keel over in just a second. His heart rate was at 40 beats per minute. 40, that's boom. Boom. Whereas us, we're going boom, 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 boom. You get it? 40 beats per minute.
Was he an athlete or no?
I said, what do you do? I said, yeah. So I asked him, are you an athlete? And he goes, yeah. I said, well, what do you do? He goes, he's a professional competitor. He's a triathlete, an Ironman.
Makes sense.
Oh, Christ. Okay. So you're good. All right. Regular rhythm, sinus. Okay, 60 to 90 beats per minute. Tachycardia, anything over 100. Okay, bradycardia, anything less than 60 beats per minute. Okay, so not only are we going to describe the rate, but we can also describe the strength. Is it strong and bounding, or is it weak and thready? Okay, and we can have regular and intermittent beats. Irregular and intermittent beats. So this is your arrhythmia or dysrhythmias. Okay, any questions? All right, no questions on pulse and heart rate? Next one here is respiration. Respiration is the exchange of oxygen and carbon dioxide. Okay, respiration is an exchange of oxygen and carbon dioxide. Bringing oxygen in, getting rid of any wasteful air in the form of carbon dioxide and other types of gases. This is important. There's a reason why it's highlighted. One respiration includes one inspiration plus one expiration. You got to have the two for it to count as one cycle of respiration. So a cycle of respiration is one inspiration plus one expiration. Okay? Adults breathe 15 to 20 breaths per minute, children 25 to 30, and infants almost twice as much as we do, 30 to 60. Okay? Now, when taking vitals, when monitoring, when taking vitals, initially what you're going to do first is you're going to take the pulse. Now, when you take the pulse, remember 60 to 90 beats per minute, are we going to take the pulse for 1 minute? That's a lot of counting, right? Can we take the pulse for 15 seconds and multiply by 4?
Mm-hmm.
Can we take the pulse for 30 seconds and multiply by 2? Yes, we can do that. Okay? More effectively is probably take the pulse for 15 seconds and multiply by 4. It's a lot easier that way. Okay? It's more accurate than the taking a pulse at 30 seconds and multiply by 2. Okay, now when you take the pulse, when you take the heart rate, continue to put your finger on wherever you are feeling for their pulse. Do not let up. Okay, when you're done, now what you're doing is you're watching them breathe. You're watching the chest, the shoulders and chest rise and go down, rise and go down. Okay, because the moment you tell them that you are going to take their respiration, they start thinking about it, right? Then they start doing this. Now they're conscious about it. It's not natural. So you're going to get a wrong reading. All right? So keep your finger on their pulse and just watch their chest rise and go down. Okay? Any questions? All right. Symptoms of difficult breathing, also known as dyspnea. Heaving of the chest and abdomen or neck muscles in the adult. So you see them just having difficulty breathing. There's going to be some tightness in the neck muscles. There may be some flaring of the nose. Okay? This is all signs that they are deprived of oxygen. So now they're struggling to get air in. Patients need to assume a sitting position. Okay? They need to assume a seating position. What is the whole purpose of having them sit up?
Expand their lungs.
Expand their lungs. Okay? When you're upright, your diaphragm is going to go down, increasing the size of your lungs. That way you can bring in more oxygen. Patients need to lean forward with arms raised. What that means is, simply, there is some physiologic changes in the shape of your lungs when you raise your arms up. Okay? Have you guys ever sprinted or ran? We all have, right? And what happens after you sprint or run? Don't you do this? It's a lot easier to do this, okay? But it's not as effective as, and you've seen this with athletes, when they're running, what do they do with their arms? they're bringing their arms up, right? When they cross the finish line, they're bringing their arms up. They're not doing this, they're bringing their arms up. That helps them breathe better, okay?